In part by My Skin and Bones.
Welcome back, everyone. 1 million Canadians live with psoriasis, an often painful and embarrassing autoimmune disease, and my dad is one of them. He suffered flare-ups for 40 years, and sometimes his skin is so bad he bleeds onto his sheets.
Wow, that's really difficult. So listen, I didn't know that up to 30% of psoriasis patients will also develop psoriatic arthritis, which is a condition that can cause severe and permanent joint damage. So here to help us learn more is ER physician and doctor, of course, Dr. Brett Belchetz. Welcome back to the show.
So today is actually World Psoriasis Day. So let's start with the basics. What is psoriasis and how can it affect you?
So psoriasis is a genetic condition with environmental triggers. It typically affects people between the ages of 15 and 35. That's when it starts, but it can start at any age. Now, the disease, we don't 100% know what causes it, but the theory is that it's due to overactivity of our immune system. And what that overactivity does is it causes excess production of skin cells on the surface of our skin, and that can lead to the development of these kinds of scales that you see in the photos there. So scales on your skin, big red patches. Typically, these are very itchy. Sometimes they can be painful.
So who is most at risk of getting the disease?
So because it's a genetic disorder, the people who are most at risk are those with a family history. Now, I did mention that there are environmental triggers. So there are other environmental factors that can play a role. So exposure to certain medications, so things like NSAIDs, beta blockers, stress, all of these can play a role in triggering the disorder to come on.
Okay, so is there anything then, if we know about these things, can we prevent it at all?
So unfortunately, you can't prevent psoriasis. It's one of these things that if you have the genes and you have the triggers, it's going to come. But it is a disease that comes and goes. So it has remissions and it has flare-ups, and there's lots of things that people who are diagnosed with psoriasis can do to prevent those flare-ups. So they fall into the broad categories of skin health and good overall health. So in terms of skin health, you want to take really good care of your skin. So keep it well moisturized. You want to avoid trauma, so scrapes, bumps, infections. You want to make sure that you stay away from areas with cool, dry air. Now, obviously that's easier said than done in Canada, but people with psoriasis really benefit from having a good humidifier. Now, in addition, good overall health is really important. So you want to eat well, you want to exercise regularly, you really want to manage stress, and you want to avoid excess alcohol. Now, one other thing I'll mention is that the sun is actually beneficial for people with psoriasis, but not too much sun, so no more than 20 minutes at a time, and definitely avoid sunburns.
Okay.
So as I mentioned, my dad has psoriasis, and his medication has kept it under control for the most part the last couple of years, but he does respond well in warmer temperatures. Why is that, and is there anything else that you can recommend to treat?
So it's interesting that you mentioned that, because one of the areas of therapy for people with psoriasis is actually light therapy. So your dad's not alone in finding that he does better in warmer places.
Right.
So when we give that light therapy, it's either in the form of natural sunlight, so as I mentioned, not more than 20 minutes at a time, or we even will do artificial phototherapy at times. Now, we don't fully understand why that's beneficial for
Right.
Now, in terms of treatments, there's a number of other things that we do recommend, and it really depends on the severity and the extent of your illness. So for people who only have localized symptoms, topical treatments are often all you need. So there's some over-the-counter treatments like coal tar solutions. There's prescription topical treatments like steroid medications. They're all pretty effective at settling down local outbreaks. But for people with more severe or more widespread symptoms, then you want to have systemic treatments, and those can fall into categories of pills that you take, sometimes injections or intravenous infusions. All of those are very effective for the more severe forms of the illness.
Now, for the past 2 years, I've partnered with the awareness campaign My Skin and Bones to raise awareness about the link between psoriasis and psoriatic arthritis. So for people who don't know, what is psoriatic arthritis and how is it connected to psoriasis?
So psoriatic arthritis is a special form of arthritis, and it affects about 30% of people who have psoriasis.
That's a big number.
It's a pretty big number, so something that people with psoriasis should be on the lookout for. So the typical course is that you break out in the skin changes of psoriasis first, and then sometime, it could be years later, you start getting the joint symptoms of psoriatic arthritis. Now, in a small percentage of people, they will develop the psoriatic arthritis, the joint pains first, and then the skin symptoms later, but that's a rarity.
Okay. If you already have psoriasis, is there a way to prevent psoriatic arthritis?
So I wish that were the case, but unfortunately there is no way to prevent you developing psoriatic arthritis if you have psoriasis. So the key here, though, is early identification of that psoriatic arthritis, because this is an illness that, if it's missed and if it's left untreated, can actually cause irreversible damage to your joints. So everybody with psoriasis should be on the lookout for the symptoms so that they can get early treatment if it develops.
My mom has osteoarthritis, and there is arthritis in my family, but what is the difference between psoriatic arthritis and other forms of arthritis?
It's a great question. It's actually one that I hear all the time. So when I think about arthritis, in my mind, there's two broad kinds of arthritis. There's what we call degenerative arthritis, which is also known as osteoarthritis. It's the one that you mostly hear about older people getting, and that's usually due to wear and tear on your joints over the course of your life, so from walking, running, everything you do. The other kind of arthritis is what we call inflammatory arthritis. So this has nothing to do with wear and tear. This is usually due to a malfunction of our body, usually of our immune system, where our immune system starts to attack our joints. So one example is psoriatic arthritis. There's other examples like rheumatoid arthritis, and there are other forms as well. We do worry about these inflammatory arthritis often more than we worry about the degenerative ones, because they can be so rapidly progressive and so rapidly destructive and lead to disability for people.
So I want to ask you this as you continue to break this down for us. What are the symptoms of psoriatic arthritis that someone like Lainey's dad should be looking for?
Yeah, so this is important to note. So the hallmark of psoriatic arthritis is joint pain, joint swelling, joint stiffness. Now, it can affect any joint in your body from your head down to your toes. So there is no specific pattern, but the thing to be on the lookout for specifically with psoriatic arthritis is that it does most commonly affect small joints. So the fingers, the toes, so you just saw a picture of somebody's fingertips. That's a really common first presentation of psoriatic arthritis. Now, with psoriatic arthritis, just like with psoriasis, it can come and go. So you can have periods of outbreaks, flare-ups, and then periods of remission. And the severity really varies from patient to patient.
Who's most at risk of developing psoriatic arthritis? Like, are people with autoimmune disorders, for example, more at risk?
So the #1 risk factor for psoriatic arthritis is, of course, having a history of psoriasis. Now, because these are genetic disorders, if you have a family history of psoriasis or psoriatic arthritis, you fall into the next category of risk. Now, typically, psoriatic arthritis also most commonly affects people between the ages of 30 and 50. Now, to answer your question, there is a link between psoriasis and psoriatic arthritis and other inflammatory conditions. So it's more likely, if you have a diagnosis of one of these conditions, that you may also be diagnosed with conditions like lupus or rheumatoid arthritis.
And given all of this, what are the options to treat it?
So there's a number of different treatments, and again, it really depends on the severity of your illness. Are you a mild sufferer or a severe sufferer? There are pills that can help to treat it. There are injected treatments. There are infusion treatments. Now, typically, the mechanism of action of these treatments is to suppress or calm your immune system. But the most important thing to know here is that you really want to catch this before it progresses. There's a really strong linkage between these skin symptoms and these joint symptoms. So for people who are having skin symptoms and joint symptoms, you want to go to the doctor very proactively, because, as I said, this is an illness that will cause irreversible damage, and the key here is prevention before that occurs.
Like, how debilitating could it become?
So it really does, again, depend on the severity of your illness. So almost half of people, it depends on the study you look at, it's about 20 to 40% of people with psoriatic arthritis will develop severe forms of the illness. And for those people who have the severe forms of the illness, if it's left untreated, it's actually almost certain that it will lead to some amount of significant disability. And if you have a very severe form of the illness, this can be lifelong disability, and this can be severely debilitating.
Dr. Brett, thank you so much for being here, sharing all of this information with us today. If you have psoriasis or a family history of the disease, like me, be proactive and make sure to ask your doctor about the connection between your skin and your joints. We'll be right back.